Have you ever wondered why we have wisdom teeth, especially when they often cause us so much trouble? The answer lies deep in our evolutionary past. Our ancestors had a diet that was tougher to chew, requiring more molars. Wisdom teeth, also known as third molars, served this very purpose, but as our diets have evolved, our jaws have shrunken, leaving little room for these late bloomers. This mismatch often leads to complications like impaction, where the wisdom teeth are unable to fully emerge or align properly. This can cause considerable discomfort, pain, and even risk of infection. So why keep these evolutionary relics around if they're causing so much trouble? Well, that's where dental professionals step in, advising on whether or not these teeth should bid us adieu. There's a lot that goes into this decision, but fret not. Today we're going to demystify the process of impacted wisdom teeth removal. Before we dive into the procedure, it's important to understand what we mean by impacted wisdom teeth. In the world of dentistry, when we say a tooth is impacted, we're referring to a tooth that has not fully erupted through the gum line due to a lack of space or an incorrect angle of growth. This often happens with wisdom teeth, those late bloomers at the back of your mouth that typically appear in your late teens or early 20s. An impacted wisdom tooth may not cause any noticeable symptoms, or it could lead to discomfort, inflammation, and even infection. Over time, it can also cause complications like damage to neighboring teeth, cysts, or gum disease. Understanding the state of your wisdom teeth is crucial to maintaining your overall oral health. Now that we've understood what an impacted wisdom tooth is, let's delve into the process of its removal. Impacted wisdom teeth removal might sound daunting, but don't fret. It's a common procedure that oral surgeons are well versed in. The journey to having an impacted wisdom tooth removed begins with a consultation. During this initial visit, your oral surgeon will examine your mouth, paying close attention to the area where the wisdom teeth are located. The surgeon might also take x-rays to get a clearer picture of the positioning of the teeth and to see if they are impacted. Once the oral surgeon has assessed the situation, they'll walk you through the surgical procedure. This usually involves using anesthesia to numb the area. Depending on the complexity of the case, your surgeon might use local anesthesia, sedation anesthesia, or in some situations, general anesthesia. The goal is to ensure you're as comfortable as possible during the procedure. After you're properly numbed, the surgeon will make a small incision in the gum to expose the tooth and bone. They'll then remove any bone that's blocking access to the root of the tooth. Once the tooth is accessible, it's time for extraction. In some cases, the surgeon might need to cut the tooth into smaller pieces to make it easier to remove. With the tooth or teeth successfully extracted, the surgeon will clean the site of any debris from the tooth or bone. They'll then stitch up the wound to promote healing. These stitches usually dissolve on their own after a few days. Lastly, your surgeon will place gauze over the extraction site to help control bleeding and to aid in the formation of a blood clot. This clot is crucial as it helps protect the site where the tooth was removed. The entire process usually takes about 45 minutes to an hour per tooth. After the surgery, you'll spend some time in the recovery room under observation before you're ready to go home. With the right care and a skilled oral surgeon, the process of impacted wisdom teeth removal is straightforward and manageable. In summary, impacted wisdom teeth are more common than you might think, and their removal is a routine procedure. Throughout this video, we've learned about the mystery of wisdom teeth and their sometimes puzzling behavior. We've discovered the meaning of the term impacted, which refers to wisdom teeth that have not grown in properly, often causing discomfort and potentially leading to further complications. We've also walked through the step-by-step process of removing these misbehaving molars. This surgical procedure, while it may sound a bit daunting, is a standard practice performed by oral surgeons worldwide. It's important to remember that your dentist will always prioritize your comfort and safety during this process. We hope this video has helped you understand the process of impacted wisdom teeth removal. For a deeper dive into this topic and many more related to dental health, head over to our blog at smile-wide.co.in. Keep smiling, and remember, oral health is an essential part of your overall health.